If you're getting value from working healthcare, I have a quick ask. Follow the podcast and leave a 5-star review on Apple Podcasts, Spotify, or wherever you listen to the podcast. That simple action helps more physicians and leaders find these conversations and better understand how our healthcare system actually works. And that matters because we can't fix what we don't understand.
You ready? You got me running.
I am Meredith Hirsh, and this is Working Healthcare. Who does our healthcare system choose to see? And who does it continue to overlook? This episode examines public health, political incentives, mental health stigma, physician exploitation, and the responsibility to care for people regardless of their income, housing status, culture, or position in society. I just interviewed Dr. Anna Viamonte Ros, who became Florida's first state Surgeon General after growing up in a Cuban family with 5 generations of physicians. She joined me to discuss leadership, politics, Cuba's controversial overseas medical missions, mental health stigma, and her commitment to serving people experiencing homelessness. I can't wait for you to hear this episode. Anna Viamonte Ros, welcome to Working Healthcare.
Thank you so much. My pleasure to be here.
I'm very excited that you decided to make the drive up from Miami because you do teach at FIU now,
Yes.
So you must not be teaching this afternoon.
Actually, I was teaching all morning, and I got someone to teach for me today in the afternoon. I'm also at Camillus. You know about Camillus
Yep.
House and Camillus Health. So I'm the administrative medical director for Camillus, where I have been volunteering since I was a medical student at UM.
Well, we are definitely going to talk about it because I want to
Yes.
talk about homelessness and,
Yes.
and mental health and all of that. But you have the most amazing background. So I feel like we get to jump from subject to subject to subject. But you've led public health for an entire state, which is Florida. You've worked inside a major health system. You've taught and you teach future physicians and now serve people experiencing homelessness. After seeing healthcare from every level, what does our system still choose not to see?
And not to make easy, I think, a lot of times for the medical students, we used to say it's so important to be insured. It's not just important to be insured, because being insured doesn't necessarily equate to access. If you have anyone in your life or that you know of that has Medicaid, ask them how easy it is for them to see a specialist and to get care. So it's not enough just to be insured, but really to provide access to care. And that, to me, is what has been so important, and I would love to see changes in that sense. But our medical system really needs a whole revamping because it's really not serving everyone the way they deserve to be served.
Well, you believe, and I know you have a strong belief about this, that people should be treated the same within our healthcare system, whether they are insured, whether they have Medicaid, whether they don't have insurance. Besides Medicaid, where else do you see this happening?
It's funny when you say that because I've always equated it to traveling sometimes to my kids. I've had the opportunity to travel coach and business and first class, and I absolutely understand that if you pay first class fares, you're going to get a wider seat and a leather seat, and you're going to get a full meal, and you're going to recline more, all of that. I understand all that. But what I've never been able to accept or understand is that you're going to be treated differently. Folks are much better treated the higher up in the travel, contingency. It's fine that you get all those amenities, but not that you're treated better. And I really feel that in healthcare especially, maybe you'll get a private room. Now everything is private, but you'll get a private room or you get a gown or you're going to get slippers or you're going to get whatever it is, but not that you're treated differently. And that's what, to me, is the sticking point. I think everyone deserves good quality care. And I've always told the students I teach too, we've all heard the golden rule that, treat others the way you'd like to be treated. And I said, I think there should be a platinum rule that surpasses the golden rule, which is to treat others and speak to others the way they would like to be spoken to and treated, and not assume that people will want to be treated or spoken to the way you do. Get to know them well enough that you know what's important to them and what they value, and try to be respectful of that.
What I tell my kids is treating everybody equal is not what I do. And I don't actually think that's fairness. I think it's treating people or giving people what they need.
Exactly. That's what you need to know what they need and what they value, and try to do that.
You're a fifth generation doctor, and your brother's a doctor too.
My brother's a colorectal surgeon down in Miami.
And you came from a Cuban family. You're Cuban American, and your family, your parents, your grandparents all practiced in Cuba because you're the first one to be in Miami. Did medicine feel like a choice for you, a family expectation, or do you think it was really a calling?
I think it was both. And in fact, I should say that I have a nephew. My brother's oldest son now is a physician as well. And in Miami, he works in the pediatrics ICU at Jackson Memorial Hospital. So I'm so proud of him. I think it was a little bit of both. I mean, conversations, both my parents are physicians, my grandfather, my great-grandfather, my aunts, I mean, all over the place. But I was surrounded by medicine and science. And I remember my mother as a pathologist in the refrigerator, just the home refrigerator, you'd open it, and I felt it was the most natural thing, but there were little bottles of things.
I was waiting for you to say that.
With little organs in it, or, all sorts of things. It was just the most common thing, so she'd go to the hospital if she was on call to do frozen sections, and I'd go with her, as a child. So, yes. And, I remember then later as a teenager and college student, knowing that I did want to go into medicine, I'd go to the morgue with her all the time. And I remember, I'll never forget, there was a big sign outside that said, at the morgue, it said, "This is where the dead teach the living the secrets to life." When she would do autopsies and all. So, yes, it was very pervasive in my family. And I love science. So it was a little bit of both.
How did none of your children go into medicine?
I think I traumatized them because when they were young, we were living in Gainesville, I remember, through their elementary school years. And I would go actually to the Publix, to the butcher, and I'd say, "Can you find me whole organs? Whole, like kidneys and heart." And I'd bring those home, and I'd bring gloves and little scissors and to dissect with them. So I think I traumatized them. But now, come to know, I've done that actually with my grandchildren in their schools. And I brought whole organs and brought for the class little tweezers and all sorts of things, and talked about organs and their function and whatever. And so I've enjoyed, maybe they'll be traumatized as well. But now I've found out, which is unbelievable, that you can actually order organs on Amazon. You can order, a lamb's kidney or a pig's heart or whatever, which is unbelievable.
Well, I know when my husband teaches ultrasound, he'll go pick up a pork shoulder from Publix or something like that.
Yeah.
So not quite the organs, but definitely parts of the body.
Even organs you can get on Amazon, which I thought was unbelievable. So now I don't have to go to Publix.
You grew up in Cuba. What did your family teach you about education and service, and also the immigrant work ethic?
Absolutely. So I think there were two main things that I think I learned from my family, and my brother did as well, was the work ethic, but also the sense that you have to give back, and that we're privileged and honored enough to have had certain experiences that really compels us to give back. and to help others. I came from Cuba very, very, very young. My dad did his residency actually at the University of Pennsylvania, and just before the Cuban Revolution. So I was born actually as a baby. That's the only time I've lived outside. So I was the first American born. Then we moved back to Cuba because Fidel had not taken power there. So went back, and when he actually came to power, my family little by little trickled out. And again, my grandparents, my aunt and uncle, my parents, everyone always instilled in us that the importance of education. That's the only thing no one can ever take from you. They lost everything, and they came with nothing but their education. And thanks to their education, they were able to, and thanks to this country, they were able to, get their life back together. And my 75-year-old grandfather, paternal grandfather at the time, had just stepped down as chairman at the University of Havana in the Department of Radiology. And when he came, at 75, he learned English. He passed all his boards. He got his license. And he said, I don't need money. I will make it on my own. I will. And I remember as a child, he had a rinky-dink little car that he'd go down to Homestead, very south of Miami, and work in migrant camps there. And I would sit next to him, and on the floor of the passenger side of the car, it was so old and it was so rinky-dink that it was rotted. It had all rotted away. You could actually see the street below. There was a hole in the car. And I used to think, again, in my childhood naivete, thinking my grandfather's the neatest guy. He has a Flintstone car. Because you could see the street just below your feet there. But again, he worked actually till he was like 3 months before he passed at 87. The other grandfather, who had been a lawyer and a banker, didn't learn English quite as well, but he worked the evening shift, I remember, at the cafeteria at the Fontainebleau. But everybody worked. What was dishonorable was not working. Every job was honorable. So that's what was instilled in us. First, education, and that you do whatever you have to do to make it and to help others.
You spend a lot of your time, you've spent your entire career helping others.
Yes.
You're still teaching and you're still working at Cornelius House. I'm going to be at the Florida Medical Association conference at the end of July, and this is the first episode that I'm airing in August,
goodness.
so I will have already been there. I'm asking for a friend. No,
Yes.
but we have a challenge with the FMA because those who are involved in organized medicine, those who are there to help and give of their time, are aging. And
Yes.
the younger population doesn't see that there's such a need to give back. Why is it so imperative to you? And what would you say to these young doctors or these young medical students as to why it is important to get involved?
Sure. I'm a very proud member of the Florida Medical Association. And the experience I've had at FIU, and I'm a UM graduate also, was that we do have students that understand the needs in the community and the importance of the underserved community, and that we are privileged enough with our education and training that we have to give back, and that we have to help those that don't have an advocate and don't have the financial wherewithal to get, very high-end care. But whenever I do my outreach, my street outreach at Camillus, I have a lot of students every night that go out with us. And I see a lot of interest and people that are going to go into all different types of specialties. And, I tell them wherever you end up training and end up living, be aware of public health in your community, be aware of the community. I'll give you an example. I think most of us live in a bubble We work and we live and we work, we go to school in a very sort of small area of town without understanding really that truly just down the street, people are living very, very differently. When we were in Gainesville, I was, like you were saying, I really enjoyed community service, even as a child. And I wanted my kids to be exposed to that as well. And I would do Meals on Wheels program. I'm sure you probably have it in your community here. And I remember going with my son, who must have been like 3 or 4 years old, and I put him in the back of my minivan, and we'd go out. Mostly, they assigned us to a trailer park community where it was mostly elderly people living in very impoverished conditions in trailers with almost no help at all. And we'd get off and we'd deliver these prepackaged meals. And of course, the conditions in these trailers weren't great and the hygiene wasn't great. And, these people and I remember my son one time, we got back in the car and he said, "Where are we?" And sort of in disgust. And I said, "What do you mean, where are we? We're in Gainesville." He says, "I don't live here." And I go, "You live like a mile down the road. You do live here. These are our neighbors." But again, we live in this little pocket of life that we just don't realize. We do our street outreach on Thursday nights at Camillus in Government Center, literally in downtown Miami, where the mayor's office is, or whatever. We were about a year ago treating a leper there. And this is a stone's throw from Brickell, where very different types of people live in wonderful conditions and beautiful high rises and whatever. This man lived literally a few blocks from there. And I assure you, these people had no idea that someone with a, condition like that was literally a neighbor of theirs. And whatever your sense is of immigration, these folks, the health of one person can affect a whole community with an infectious disease or whatever. So it's not that you can be so insulated that you won't be affected. Not only I think it's the right thing to do, and this is the humane thing to do, but even selfishly, people with certain contagious diseases can infect, if you don't treat them and you don't do preventive care and all sorts of things, a whole community.
I think a lot of it stems, though, from the way that you grow up.
Yes.
So you saw this through your parents.
Yes.
You taught it to your children. My mom was a social worker. My mom used to bring people home. Like,
Sure.
I don't know, there's
Yeah.
something about safety as well when you're a kid. But I learned from that. So when I was in
Yes.
Gainesville, I volunteered at a place called Mount Olive Educational Center.
Right.
I don't know if you're familiar with that up in Gainesville, but I used to tutor underprivileged
Sure.
kids.
Absolutely.
And I grew up doing all of this. I went to Santo Domingo, the Dominican Republic, when I was 17 for an entire summer with 7 people from my high school. And I went to a Catholic high school, so there were nuns who went with us as well because it's all about giving back. And when we were there, we worked at orphanages and
Absolutely.
schools and hospitals. And so this is part of who I am. People will look at me and say, "Why do you have this podcast?" and think that it is a way for me to make money. And I will tell you, it's the best thing I ever did. 1, I get to meet cool people like you. But 2, it really helps me to learn and to spread the knowledge, because I go back to what we say at Working Healthcare. Besides knowledge is empowerment, but you can't fix what you don't understand.
Exactly.
And as you started, we have a lot of fixing to do within our
lot.
American healthcare system.
A lot. Absolutely.
And so this is my way of giving back, and I really enjoy it.
Absolutely. Absolutely. And again, it's so apolitical what we're talking about, because it's just another fellow human being that's in need or that's sick. Or I remember also, I don't know if you've ever driven up the the center of Florida, Route 27, I think, that goes right through the center of Florida.
I probably have because I was in Gainesville for 4 years.
Yeah, all the way, past Lake Okeechobee and all.
Yeah.
And I realized that we're a very rural state.
We are.
Except for pockets of great affluence and urban, conditions in the southern coastal regions. The rest is very, very rural and very underserved. And I remember visiting one of our health departments there on the shores of Lake Okeechobee, and one of the citrus growers came to see the Department of Health and for us to meet. And he was appalled when he saw the services that we provided. And I said, there were very simple things there. And he said, most of these people that you're treating are my workers, are Guatemalan. They don't pay taxes. All the money that they make, they send back to their countries, and you're giving them free care. And I said to him, you know what? I believe that there should be a mechanism by which, if you live in this country, you contribute to the community that you live in. But let me ask you something. Why did you hire them? Why are you enabling a behavior that you're so critical of?
Mm-hmm.
Well, it was obvious why he hired them, because it was very low wage, laborers. And I said, don't you realize that you can't make sure that people don't get sick? People are going to get sick if they're here. And would you rather we care for them in a very low cost preventive setting, or do you and I want to pay when they really get sick, a very cost setting in the emergency room? So again, this is not a political issue. People get sick. And, do we treat them? Do we not? What do you do for them? And to not only, again, it's the humane thing to do, but to make sure that the rest of the population is healthy and is not in danger of anything else.
Your kids did not go into medicine, but they went into law.
They
so
did.
It is still it could be a very give back profession, but it definitely requires education, which goes to your point. Nobody can take away your education. What do your kids do to give back?
So it was very interesting because I was, again, because education was so important. And I remember telling I have two children, a son and a daughter, and 2 years apart. And I remember telling them, listen, this is a football team, and I'm the quarterback, and you're the wide receiver. And I will make sure that you get the ball. I will make sure that you get the tutoring that you need, that you have the experiences that you need to have, that you have all these opportunities. I will make sure of that. But once you get the ball, you know where the goal is, and you have to run. I'm not running. I can't run for you. So I'll make sure everything else, is given to you on a little plate, but you need to run the ball. And I am so, so proud. They both were National Merit Scholars. They both got accepted to all the schools they wanted to. They ended both of them going to Harvard. And I paid by myself. That's why at an old age, I'm still working, and I don't think I can ever retire. I paid 15 years of tuition to Harvard. They went undergraduate, they went to master's, and they went to doctorate programs. And my daughter, actually, Harvard doesn't have, and I was at Harvard as well. And in fact, showing them how important education was, I went back to get my master's in public health. I said to them, they were both undergraduates at the time, and I said, whoever gets the best grades this first semester will invite the other two out for dinner. And I said, it's the best meal I ever bought, because I beat them.
That's awesome.
But I really believe that was my choice to do. They don't have debts to pay back. I don't have anything to leave for them, but that was what I chose to do because I really placed such a premium on on their education. And my daughter, they don't have sororities and fraternities at Harvard. They have social clubs. And my daughter was in one that's called the Bee, like the bumblebee, the Bee. And it was had always a social bent. And obviously they had garden parties, and they, very nice. And she actually started with a couple girls the first social impact initiative at this club, and they started an organization called Circle of Women, and it was to promote education of women in third world countries. And they built schools, and they trained teachers, and they provided books and all that. And that's still in existence, Circle of Women. You can look it up. And she started that at Harvard. So again, I think their sense that we have to give back, and we have to be able to give others maybe the chances that we've had, but they haven't had.
When young people see all of this around them, because in 2026, there's a lot going on. We have a lot of debt, there's a lot of bureaucracy, burnout, and loss of autonomy in medicine. Are we still giving people enough reasons to become physicians? Because like you, I don't have one kid who's going to be a doctor.
You're right. You're right. And I think that's when you talk about, people being burned out and people being disillusioned. The other thing I just read the other day, because I was part of the American Medical Women's Association at the national level, I was on the board. And I remember a statistic that I thought was unbelievable. And that was that 40% of women within 6 months of finishing their fellowship or their training either go part-time or leave medicine altogether. 40%.
Oh, I believe it.
Oh, my goodness.
Let me tell you about my practice. I have hired 3 women, okay? The most recent only started in October. I love her. I hope she stays forever. But the 2 women I previously hired, one never started full-time. She went 3 days a week, and she's always been 3 days a week. And she had her 3rd child recently and ended up leaving the area because she wanted to be closer to family. The other physician I hired worked for us for 3 years, had her 3rd baby. I feel like this is a story, but she, starting with us, worked full-time for about 10 months. And then she was like, I can't do this anymore. She went to 4 days a week. She went to 3 days a week. She went to shorter days, 3 days a week. And when she had her 3rd kid, she still doesn't practice medicine.
Right. And
13 years of rheumatology training.
I do a lot of STEM teaching of students in the undergraduate level also. And I realize it's not so much the pipeline, because our medical schools now and our law schools, actually the classes they're more weighted for women than men. It's once you are in practice, it's being able to retain women and being able to promote women and being able to have the flexibility to look at part-time work, look at flex time, look at sharing time, whatever, but not lose women. Yesterday I read also in Medscape that men frequently work till retirement age, and that 36% of women leave in their late 30s practice. And I'm thinking, oh my goodness, what a shame again. Why don't we value their contribution and have that flexibility during child rearing years to not lose such an important resource?
I think it stems from the support that a woman or mother gets from home.
Absolutely. We don't have it. We don't live in multi-generational families anymore. My grandparents always lived with us. My grandfathers always picked me up after school. I mean, yes, it's very, very tough. I know that the other thing also is in my own particular situation, my mom, and that's why I'm very interested in, I know we'll talk later about mental health. My mom became physically and mentally ill when I was very young, and she was my responsibility. And I knew that. And I remember telling my husband when we got married, I want to be completely, clear and open. And transparent. My priority is my mother, and she will always be my priority because there's no one else. She is my priority, and I will care for her. And as I did, and she lived with us in Gainesville and in Washington and in Boston, everywhere, and she couldn't care for her own mother. So my grandmother came on board too. So they really couldn't help me with my children. I, in fact, was the caregiver to them. And there was a period of time that I said to my husband, if there's one thing that I have to do well is caregiving. And we'll see what happens afterwards. And my mother, I remember having a very hard time because for her, her career was extremely important when they came from Cuba. And she really felt that I would be at a great disadvantage when I went back to work because I had taken time off. So she was very, very concerned about that. But again, that to me, I was always thinking, you know, on my deathbed, what will I be most proud of? And it's to do what I needed to do for my mom and my grandmother and my kids, not the positions I held or the titles I held. That is incomparably unimportant compared to what I had to do. But society doesn't value that much.
They don't.
They don't at all.
And I took time off at the beginning of my career. And I think that's why I'm still working these crazy hours at my age, because I had the break at the beginning. I got married at 21. I had my 3 kids very young. And my mom was ashamed of me for not going back to work.
Isn't that unbelievable? Yes. And I remember when I went back to work, what was I told? Oh, yes, when actually the youngest went to college at that time, and I was going, and somebody said to me, oh, you're finally going to do something.
Yeah.
Or something like that. And I thought, what do you think I've been doing all these years? But that's not valued. Mm-mm. It really isn't valued. But internally, if I look back in my life, there's nothing that I have done that's of greater value than that. And that I'm again, don't expect anybody to pat you on the back about it. Don't expect even the people that you're helping to be particularly grateful to you. No, it's what I really felt I needed to do and I wanted to do.
And I think it depends on, again, I'm going to go back to the support system that you have at home.
Absolutely.
My mother-in-law took the first 10 years off after finishing her master's degree, and she stayed at home for 10 years. She's still working. I'm not going to say how old she is because she would be upset at me, but she's still working. She runs a charter school right near the university, right near the Miami airport.
Wow.
And that is a pre-K through 12 school. So it's a lot of work involved, but she's the head of school. My cousin just turned 65 years old, and she and I have kids about the same age because she started later in life, but she took 12 years off, and she just went back to work about 7 years ago because she just wanted to be able to do it, and she had the support at home, and I just hung out with them. She's in California, but we met up in Des Moines to hang out with a bunch of my cousins, and it was a great experience. But it is, again, society doesn't value that, but you need to have the cheerleader at home.
Right. But we should be cheerleaders for each other.
Agreed.
You know, and I think, again, when one woman said to me, oh, you're finally going to do something, I was thinking to myself, oh my goodness, rather than, you know, being supportive, I think I've done a lot, and it wasn't anything that, you know, I could put on a CV or something, but it was important to me. But we need to support each other, and we need to not devalue anyone's choice, because we don't walk in anybody's shoes, and we don't know why they made the choices that they made, and help them when they do. My mother would say, but, you know, to get back, it's going to be so hard for you, and it's going to be, yes, it was. It was. You know, it was, but I did it, but just being supportive of each other, but not just men being supportive of women, but women being supportive of each other.
Well, that's what we talked about, and that's how you and I met.
Yes, that's super important, and not put anyone or pit anyone, oh, because you're a working mom, or no, I'm a stay-at-home mom, and one is more valuable than the other. No.
I think it's way harder to stay at home.
Oh, my goodness. Absolutely.
Way harder. Let's talk about articles we've read recently, because I read an article in the Wall Street Journal recently, and I didn't know this. I didn't realize that Cuba is known internationally for training physicians, but then they send them abroad to other countries. What do you think Cuba understands about medical education and public health that others don't? Do you think it's a goal to train people and to educate people? Or do you think that there's an ulterior motive?
I think that they always had a very, very high level of medicine. When my parents lived there, my grandparents lived there. Unfortunately, now they don't. I mean, those of us that still have family there, we send Band-Aids over. We send penicillin over. I mean, they don't have even the most basic of, but their education is very high. And Cuba has no currency. They don't have sugar or tobacco or anything else, or coffee or anything to barter with other countries. They have human capital of physicians, and it's very interesting because there are a lot of physicians that have come from Cuba. In fact, I work with 3 of them now at the clinic who were physicians in Cuba, and they're brilliant. They're phenomenal. They weren't able to finish or reinstate their medical license here in this country, but they got their nurse practitioner license. So they're acting as nurse practitioners, and they're phenomenal. And like that, there are many, many, many folks. So it's a way to, I've met Cuban doctors, like you said, I've met them in Ecuador. They have a big exchange program there. They had a long time very similar governments, so they had a need. They had a communist government as well. So, anyways, but yes, they do go abroad and they have experiences that are unbelievable. But they come here and they see the opportunities that are here. That there's just no way that they could replicate anything like that.
Well, the Wall Street Journal article actually reported that more than 24,000 Cuban doctors and healthcare workers serve in more than 50 countries, and that the missions generated approximately $5.3 billion actually for Cuba in 2024. How do you
paid for that?
Exactly. How do you view these medical missions?
I mean, I've always been on medical missions, not because the government has sent me, but because I've chosen to do it. But yeah, I mean, unfortunately, it's a regime that you do as you're told. And if you're told to go to Angola or to wherever it is, you do so because your family otherwise would be adversely impacted and you wouldn't have opportunities even to come back. So
do you think this medical diplomacy is like physician exploitation, or do you think that it is a way to give back to other countries?
I mean, things that are coercive is never certainly what you would want to do. And they go to countries usually that are in great needs as well. But in their own country, they have, I just heard something the other day which absolutely floored me. The lady who I go to have a manicure with came not that long ago from Cuba, and she sustained on a little moped an accident, and she broke her leg. And she required surgery. She was, in a cast for a while. And what would happen here in the States, of course, we all know they'd go through a rehab period afterwards. Well, there was nothing to help her with rehabbing afterwards. There was no physical rehab that was offered to her. And one of the doctors said, we have these Russian, I'm sure you have in your home, these Russian washing machines that you load from the top. And he said, sort of get up on a bench, put your leg in there, and turn it on. That's the best rehab that you're going to have with the motion, with the massage, with the water temperature, whatever. That's what she had to resort for.
Do you think though host countries should pay Cuban physicians, I'm going to say directly, as opposed to
Of
paying them
course
through
they
the
can.
government?
It's the government. This is again, a barter system
Yeah.
or a financial. They have nothing else to give, and that's how. But of course, these people are the doctors that I've been to Cuba once had no car. They rode a bike to work, and like that, everything else was of again very very poor quality, very very well trained, book learned people that wanted very much to serve their population, but their hands were tied with the resources that were incredibly lacking.
In 2007, you became Florida's first state Surgeon General.
Yes.
While also serving as Secretary of the Florida Department of Health.
Yes.
Most people hear Surgeon General and imagine a spokesperson. But what did you really do?
So I was in the country as a whole. There were only 3 state surgeon generals, but unlike me, they and even at the national level, they segregate the Health and Human Services Secretary, which would be in our case the Secretary for Health, from the actual Surgeon General. And the Surgeon General's role is really one of spokesperson, advocacy, et cetera, whereas the Health and Human Services Secretary, or in this case, the Secretary of Health, is more operational, running a department, a whole state's Department of Health. I had 16,000 employees. So here we merged both. So I was both a spokesperson and an advocate, but at the same time, organizationally, the head of a very large department.
What responsibility came with holding that office in Florida?
It was huge because we have 1 in 5 people in the state of Florida that don't have insurance. We have very, very high immigrant population. And we have, again, regardless of what your political position is, we had at that moment what we're facing now at the national level, an administration that was not in favor so much of immunizations and vaccines. And that to me was sort of a line in the sand a little bit. And I would speak to the governor and I would speak to the chief of staff and I'd bring in spokespeople that were from the Department of, the Florida Department of Pediatrics and the CDC and whatever. These are the best minds. This is the best science. This is what we should be doing. There's no credible, respected literature that says otherwise. And again, we have a very high immigrant population and a lot of people that are uninsured. We absolutely should not add at the time another reason for people not to get vaccinated. We already, in most states, have religious exemptions and we have medical exemptions, children that are on chemotherapy or whatever that can't, their bodies can't build an immune response, and we have to be very careful. We should not add philosophical exemptions as well. That's what they were proposing to do. And I said, it just doesn't make any sense. We have so many people. We have an elderly population that would be at risk. We have, we just shouldn't do this.
This was
the wrong thing to do.
And this was 2007
This was
to 2011.
Yes. So I did the best I could. And of course, I was reminded a number of times that I was not elected to the office, that I served at the will of the governor. And I felt they were right, and somebody again said to me, the football analogy, this is a football team, and the governor is the coach and you're the quarterback, and you either run the play on the field or you get off the field. And I thought to myself, that probably would be the easiest thing to do, but is it the right thing to do? They'll just get someone that feels that way and doesn't want to challenge the leadership. And I was challenging them in a very respectful manner, and I think in a very science-based manner. And I said, no, I'm not going to go away, but I am going to give information and garner the support of all these other organizations, Healthy Start and the Florida Pediatric Society and many others that can speak up and that can write editorials and can go to the subcommittees and give their opinions. And we were successful at the time.
What accomplishment during that period are you most proud of today?
I'm really proud of that. We really did very, very well with that. The other thing I'm very proud of is that we were at the time the largest primary care providers in the whole state of Florida. Some of our county health departments were federally qualified health centers, but most were not. But we were everywhere, and we provided good primary care services. We provided mental health services. We provided dental services, everything to folks that otherwise prenatal care, postnatal care, all sorts of things. We ran the Women, Infant, and Children's, the WIC program, children's with the developmental conditions. We provided children's medical services. I mean, there were so many things to be proud of. During the time I was there, I thought, we have Toys R Us. We were like Disasters R Us. We had, I don't know how many hurricanes. We had wildfires. We had the Gulf oil spill. We had the Haiti earthquake that we had to bring a lot of people from Haiti here. So, I mean, it was like, okay, what's our next? And we did really, really well. And the other thing I was incredibly proud of was the workforce. People think that, these folks that are government workers are lazy or aren't particularly accomplished. I found the most hardworking and the most accomplished people that I learned enormously from in the workforce of the Department of Health.
You've described that role as leaving scars on your back.
Oh, yes.
Yes.
Oh, yes.
And I'd love to know and understand the whole political world really intrigues me. What did you mean by that? Can you describe the scars on your back?
Because I found very, very few, and I don't care, again, if it was Republican, Democratic, legislators, independents, whatever. I sort of clumped everybody together in a group because I found very few people that were there for the right reason and not their own stepping stone for another position. I never learned to play the game. I never learned, to leave and have cushy board positions afterwards or have benefits because I facilitated certain contractual situations with organizations. I just couldn't do it. I did what was right, and I guess that's why I'm still working, and that's why I'm in. I just couldn't do it. I had to do. I really, really felt I had to do what was right, but I didn't see a lot of people, even at the national level now, that are in their positions for the right reasons, and I don't see a lot of people that go into these positions, earning $150,000 a year that don't come out of their positions wealthy, really wealthy.
Do you think they enter it though with
knowing
the
that?
right? No, with the right intent.
No.
And do you think
No.
being in there skews them?
No.
You think they go in with malintent?
I think they go in with their eyes open and they know what it'll take to get the compensation that they're looking for and the promises that they will, and the special treatments. And yeah,
It's how I feel. When I go to Tallahassee, I used to go for 3 days. And we only spent about 2 days on the hill, if you want to call it a hill in Tallahassee. And I lowered it to 2 days. And now I literally only go overnight because I don't like it. It doesn't feel good to me. We spend 1 day, I literally fly in as early as I can in the morning. I will spend all day. I will stay overnight and I will leave on the last flight the next day because it's just so inauthentic to me.
It's inauthentic. It's very transactional. At all levels, the state and the national level is all what, we had talked about that before also. I learned that term WIFM, that the acronym, which I had never heard of before, what's in it for me.
Mm-hmm.
And that's how my experience was. That and that's why I used to tell the folks that I worked with in the Department of Health, I said, guys, we're representing people that most don't vote. They certainly don't have lobbyists, and they certainly don't give money to campaigns. Where do you think we are, before we get to the door of the legislator and their staff's office? We're the last person in line.
But you were also the first woman and the first Cuban American to lead the Florida Department of Health. So I want to know how people responded to you.
Gosh, if they responded poorly, I wasn't aware. Maybe they did. I don't know. But I really felt very supported and very people. I visited all. I didn't even know we had 67 counties in Florida before I started in that position. I went to every single county and drove myself and visited and thanked profusely the people that were working with a lot of times few resources and not a lot of support or respect from Tallahassee or the communities.
Do you think WIFM, what's in it for me, is limited to politics?
Oh, no.
Yeah.
It's in life.
Yeah.
It's in life.
So I think that's what's difficult when we work to encourage this younger generation to get involved. I mean, they see it with the insurers, they see it with hospitals, they see it with the pharmaceutical industry, at least when I'm talking about healthcare.
Absolutely.
And all of these healthcare organizations, they're like, I'll do this if I can get something back for it.
Exactly. Yeah, that's life, and that's sometimes human nature, I guess. But we need to just have eyes wide open and realize that the folks that, I'll give you an example. There was a hospital that I was with that every hospital has, VIPs, and they have to raise money. If you don't have money, you don't have a mission. But, if you give a certain amount, you have a special telephone number that you call to get appointments. And once you get there, you have a special floor that they'll put you on and special amenities. That's okay. But I always thought the folks that really need that VIP service are the people who have nothing, that don't have money, that don't have a health advocate, that don't have anybody sitting with them, that aren't dying alone, that otherwise would die alone. Those are the ones that should be our VIPs, that we really need to make a special effort. I know, again, you have to raise money. I know that's reality of life. But on the other hand, value those other folks that just don't have the wherewithal.
What would you say to a leader, though, so that they would remain pragmatic as opposed to complicit through all of this?
Keep reminding them. And most of the leaders, it's a business. Medicine, as you know, is a business now. And doctors are not good. In fact, there are a lot of students that come up to me because they know that I've had, in addition to a medical degree, a public health degree, and they'll say, I want to combine and do public health while I'm in medical school and get a degree. And I, most of the time, try to steer them to business school instead of to public health.
So do I.
Because I think it's so important.
It is.
And medicine has become a business.
I think it's always been a business. I look back and I teach at Florida Atlantic University. Yes. And on the first day of class, I will ask people, what is medicine? What is the goal of healthcare? And they come up with all of these ideas. I'll go, okay, what's the goal of any business? And a few of them, sometimes, depends on the year, will say to make money. And I'll say, you could be the American Cancer Society. Right. You have a mission, but the goal is still to make money. Absolutely. Because you cannot reach your mission if you don't have money.
Absolutely. But I maybe out of ignorance, it was never taught to me in medical school. It wasn't obvious in my face in my residency. It just wasn't an issue that I contended with. And I find that physicians nowadays are not in control and are like widgets.
They are. They've become commodities.
They're commodities, exactly. And I never had felt that. And I don't think my parents ever spoke as if that was their experience either. So it's become more like that. And we just, they always say, if you're not at the table, you're on the menu. And I think the physicians have historically not been at the table to make decisions with the Affordable Care Act, with anything, because we just are not savvy from a business standpoint. My gosh, I didn't go to medical school to understand contracting and do. Well, yeah, now we really incorporate all of that in our medical school teaching.
It is so important, and it reminds me to say yet again, that's why it's important to be a part of organized medicine.
Yes.
So that you can work with others and learn from others and be a community so that doctors are at the table. What I think is an amazing statistic is that the Florida Medical Association, their political action committee, raises more money than all other 49 U.S. states,
Isn't that
societies
something?
combined.
Wow. I did not know that.
That is impressive. I want to go back to the PBS special that you actually did. It's called Help Is Here, which addressed mental health stigma and access. And I know this is very near and dear to your heart. Why do you think mental illness is still so difficult to discuss, specifically in Hispanic families?
I think in a lot of minority communities, it's difficult to discuss, and I'll talk about my community. But I'm a board member of NAMI, the National Alliance for Mental Illness, and anyone who's hearing this, you can look it up, NAMI, and all of our services are free of charge, all of them, from the peer-to-peer groups, to webinars, to all sorts of activities. We just did our annual walk to raise money around the Marlins Stadium. But it's really important. And to me, because of my experience primarily with my mother, and I realized how averse people are to speak about mental health. And there are a lot of talking points from, again, leaders and politicians, whatever, but in reality and in action, people don't admit to it, don't admit, their family, themselves or their family members or their good friends. I remember in one of the hospitals, I had gotten several physicians that were very, very discerning and very aware and enlightened, and were willing to talk about the experience, about their own or a close family member's mental health challenges. And I asked the leadership, would any of you join us when we're doing this webinar? And not one person. I think, oh, yeah, that's really important. But the reality was that nobody would admit to anything.
Because it's seen as weakness.
It's seen as weakness. It's going to affect my being promoted. It's going to affect the way I'm being seen as. I'm also a board member at the Professional Resource Network. I don't know if you've ever heard of it, but it's for physicians that have impairment, either most of the time drug abuse or alcoholism, but behaviors also that has caused them to either have a suspended license or a license that's put on hold for a while, and they go to Professional Resource Network to see if for treatment purposes and to reinstate, hopefully, their licenses. But again, being able to not be embarrassed to talk about it, knowing that every single one of us, whether it's ourselves, whether it's a close family member, a close friend, that we are all struggling during a period of our lives, either in a chronic manner or in a very acute manner, but that we all need to support each other and need to be able to normalize discussions about mental health. I think it's extremely important. And what I taped for PBS at the Health Channel was about my experience as a caregiver since I was very young. And again, because I was not knowledgeable at all about this, feeling terrible because I would tell my own mother, because I was really, really my kids hate for me to say this, I guess, but the perfect child. I wanted, to not give her any headache ever or any cause for concern. And I would feel so bad because she was so profoundly sad always. And I would say to her, but Mom, what can I do? Why am I not enough? And not realizing that it wasn't a choice she made. It was an illness. It wasn't that I wasn't enough. It's that she had a disease, just like you have diabetes or you have heart disease or you have whatever, hypertension, whatever. It's a disease, and it's not something that you can turn on and off, and it's not your willpower to make it different. And I remember the other thing I think I made a point of saying was that I don't remember anyone ever asking me how I was, because I was very, very young, and sort of chastising myself, thinking, why are you, that's selfish of you. The person who's sick is your mom. It's not you. So why, you have to be fine. You don't deserve like anyone's concern because you're not sick. So anyways, I just feel that everyone needs to be open about it. And in the Hispanic community, it's a shame, it's something that's shameful to discuss it, and to certainly not to admit it or to get help. You pray for it, you keep it within the family, you're very private about it. What is my neighbor going to say about me as a parent if my kid is in need of something? How have I failed as a parent when my child is struggling? And it has nothing to do with any of that. So we just need a lot more conversations and education to make sure.
To normalize it so it does not
normalize it.
appear as so much of a stigma.
Exactly.
And you now serve, as you had said previously, as administrative medical director at Camillus Health.
Yes.
What does conventional healthcare misunderstand about people who are homeless?
My experience has been, and I volunteered there as just a volunteer, not working there. I've worked there only for the past 7 to 8 months, I think it's been. But I volunteered there since I was a medical student. And what I have learned is that a very, 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 very high percentage of folks that are homeless, now they say unhoused.
I know, I don't say that. I'm not very politically correct.
Are mentally ill. And you can't reason with someone that's mentally ill. Folks need a lot of support, and it's not just housing, but they need social work, and they need case managers, and they need mental health and physical health. That's the other thing that was funny, because I've told my medical students too. A lot of times I remember people that were frequently coming into the emergency rooms. Oh, don't pay attention. They come here all the time. They're mentally ill. And I'm thinking to myself, people that are mentally ill are also diabetic and are hypertensive and are, they get sick also like the rest of us. So it's not everything in their head.
Why do you think our healthcare system, though, separates the medical, behavioral, and mental health aspects of a person's life?
I think there's not a lot that. Okay, so if somebody's truly, truly sick, mentally sick, what can we do for them? Yes, we can sedate them, medicate them so that they're sedated and that they're not acting out or aggressive, whatever. But actually curing, there's not a cure, for some of these things. You can control things. And it's not like an ear infection, take this antibiotic for 7 days. This is lifetime commitment to their illness. People are also, one other thing I wanted to mention, they fear what they don't know. So a lot of times people that behave poorly or dangerously, they must be mentally ill. So you fear then, oh my God, everyone who's mentally ill, dangerous and a criminal and willing. So there's a lot of components that go into all of this. But there is no parity as far as our health insurances. Try to get an appointment. I don't know up here, but
you cannot
try to get.
Find
you cannot
a
find
child psychiatrist
No, you can't.
Even if you want to pay cash.
And that's the thing. If I can't think of any psychologist or psychiatrist where I live that's not cash pay. None.
Not up here either. And you're on a wait list.
You figure it out on the back end with your own insurance. But so what does that say to or make it, how much more difficult can it possibly be, if you need help?
I just re-aired Allie Kaufman's episode. I aired 4 foundational working healthcare episodes. And it was important for me to air Allie's because we talked about mental health and we talked about the fact that because there are no psychiatrists and psychologists, especially in network with insurance, God forbid, Medicaid, okay?
Exactly,
Never.
exactly.
That it's getting turfed to the school system. And so you're having teachers having to handle all of these behavioral and mental health conditions of these young children. What I'd love to know, because you are also an instructor at FIU, you do everything. I'm telling you, Anna, everything. Do you think empathy can be taught? Or can medical education only protect or erode what somebody has naturally in them?
That's such a great discussion that I have with our students because I teach a class called professionalism, and we teach about compassion and empathy and all of that. And I teach these 20-some-year-old kids. Well, they're kids to me, but they're in their 20s, whatever. Can you teach that, or are you born empathic or compassionate? To me, I always toggle between, do you have some innate quality to be that way, or can you actually teach it? Teach somebody to be empathic or compassionate. And I don't really know. I think, though, that a lot of times because of our medical system and just the world we live in, we lose some of that, and it's eroded from us. Those of us that and you become hardened, and you become, jaded sometimes about things like that, even if you are naturally tend to be that way.
So after working in government, academic medicine, health system leadership, and caring for the underserved population, are you more optimistic or are you less optimistic about our ability to build a fair healthcare system?
Gosh, I want to say that I don't know, but I'd like to say that I am optimistic, but I don't know, honestly, if I am. I tell our students, I see my own children, I see my grandchildren now, my 7 grandchildren, and I want to be optimistic. I want to see people that have been, that you nurture and that you give good examples to, that they will follow, in your steps and try to make a difference. I mean, I really want to think that.
So I'm going to ask you to be optimistic because we're going to make a change within our American healthcare system.
Good.
And it's the way that I end every single episode. If you could create one change within our American healthcare system, what would be the most impactful?
Providing access to care, making sure that people have a basic health opportunity, regardless of whether you're insured or not insured or documented or not documented, but that everyone has access to care and not insurance is a more, I think, overwhelming situation for families than even seeking care. And that should not be. And just have basic health care for everybody.
Anna Viamonte Ros, thank you for joining me on Working Healthcare. If this conversation hit home or made you think a little differently, don't keep it to yourself. Share the episode, tag a friend, or post about it on social media. Connect with me on LinkedIn to keep the conversation going in between episodes. If you've got a question, an episode idea, or someone you think I should feature, send me a note at meredithhirsh.com. Thank you all for the 5-star reviews. They help more listeners find the show. New episodes drop every Tuesday. Subscribe so you don't miss what's next. Tune in weekly as we explore the inner workings of healthcare, because you can't fix what you don't understand.